Hi, this is your San Jose chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic, and this video is about carpal tunnel syndrome and the warning signs associated with it. Carpal tunnel syndrome is caused by the compression of the median nerve as it passes through the wrist, which can result in pain, numbness, tingling, and in some cases like a weak grip. At first, these symptoms are mild and infrequent, but over time they can become more intense and they can become more frequent, and then they can even last longer. Most people don't react to these initial warning signs, which is too bad because carpal tunnel syndrome is much easier to treat when it's in its early stages. Risk factors for developing carpal tunnel syndrome include being female due to hormonal shifts and also having a smaller carpal tunnel in general. There's also jobs that would make your risk factors increase, such as people who have to do a lot of gripping like carpenters or tradesmen. There's other people who work with fast repetitive work, people who work in line assembly, people who work in poultry or meat packing jobs, people who type a lot, we're all on our computers a lot, and also transcriptionists. There's people with certain illnesses that are prone to carpal tunnel syndrome like diabetes, hypothyroid, inflammatory arthritis. Being pregnant is also a risk factor for carpal tunnel syndrome. Sports injuries, and other stuff as well that can be risk factors. Those are just the most common ones. Non-surgical care for carpal tunnel syndrome would include using a night splint, which basically goes around your wrist and keeps your wrist from moving around at night, going into positions that can be problematic. Also using some sort of anti-inflammatory measures such as using ice can help. There's other things that chiropractors can do besides those two things. They'll always do those things, but also doing manipulation to the neck, the shoulder, the elbow and wrist, and the hand. Mobilization and muscle release techniques will help get rid of a lot of the tension and the inflammation, tightness into that area. Exercises are also used in chiropractic offices, education as well. A lot of ergonomic stuff will be talked about and discussed. I know in my office I just have people take a picture of their workstation with them at it, and we go over what we can do to improve it. Serious warning signs with carpal tunnel syndrome would be like a long-standing history of carpal tunnel syndrome, usually years lasting. Severe symptoms of carpal tunnel syndrome is another warning sign. Muscle atrophy can occur with prolonged carpal tunnel syndrome that hasn't been addressed. And if you have anything like that, you just want to look at like the thumb pad here in your hand, make sure it's not looking smaller than the other hand. If you have any early warning signs of carpal tunnel syndrome, please go see a doctor of chiropractic as soon as possible. Much easier to get treated in the beginning phases of carpal tunnel syndrome rather than waiting till the last minute to get it taken care of. So that's it for me. I'm Dr. Will Holdsworth, your San Jose chiropractor for Pain Relief Chiropractic, and thank you so much for watching.